Welcome to my vlog! I just finished working and today I'm gonna give you a life update. So, if you're not yet aware, I have a TikTok account. It's called Dr. Don Tan. Dr.Dawntan. Dr. Don Tan. And you know what? I get so many questions that are related to eye and vision. So today, we decided that I'm gonna answer them one by one. Are you ready to listen to my answers? Let's get started. So, when you talk about keratoconus, we are specifically dealing with a deformed cornea. Yung cornea, that's the frontmost covering ng ating mata. It's transparent and it's very important na regular yung shape niya para when light enters the cornea, it enters it in a straight manner. So pag straight and well-focused yung light, clear yung vision. Pero pag deformed yung ating cornea because of keratoconus, light is dispersed in all directions. So it doesn't follow a straight path, kaya medyo blurry yung image. And the more deformed, the higher the deformity, the worse din yung vision ng patient natin. There's so many ways that we can correct keratoconus depending on its severity. On worst case scenarios, which is very minimal lang, siguro mga less than 10% of the time, that's when we will need a corneal transplant. But 90% of the cases of keratoconus don't need corneal transplant. So what do we do with this 90% of cases? Pag mild lang, we can just correct it with glasses. Second, we can correct it with specialty contact lenses. With specialty contact lenses, what we're doing is we're trying to put a lens right on top of your cornea para ma-compensate natin yung deformity ng cornea mo. This lens will make parang artificial cornea para when your light enters that lens, it will follow a straight path. Para kahit deformed yung cornea mo, because of that lens that's compensating for the deformity, you can still see clearly. Retinitis pigmentosa is a genetic problem in your retina, specifically on the rods. So sa retina natin, we have two kinds of cell. We have rods, we have cones. So the rods, they are responsible for our night vision. Okay? Yung pag madilim and you can still see clearly, okay? Yun yung night vision natin. Now, if you have retinitis pigmentosa, you have night blindness. So you cannot see in the dark. You are blind as a bat in the dark. Now, can this be treated, retinitis pigmentosa? As of the moment, there are still no treatments with this genetic problem. But hopefully, in the future, we can treat it. If you're vomiting and parang ganon, it's not normal eye strain anymore. I actually have a similar experience. Back in college, actually, I started wearing glasses in college. I think I was second year when I started wearing glasses because I could no longer see the board even if I was in front. And my grade that time was around 100 or 125 pa lang or 75. Basta mga ganon lang yung grade ko. And then, napansin ko, tuwing exam week at kailangan kong mag-aral ng sobra-sobra, I experience yung ganyan, yung nafe-feel mo na nasusuka ako at sumasakit yung ulo ko at parang naantok ako. Pero the next day, okay naman. Tsaka, hindi ko naman naisip na nasusuka ako or what because of hyperacidity or because I'm hungry kaya nahilo ko kasi malakas akong kumain. Lalo na kapag nag-aaral ako, nagsa-study ako, I eat a lot. So I really felt like this must have something to do with my eyes. And it really had something to do with my eyes. So paano yun, di ba? Nag-glasses na ako, may problema pa rin ako sa mata. Yes. Kasi yung glasses na ginagamit ko was helping me see well sa malayo, sa blackboard. I can see the blackboard clearly. But during the whole exam week, I'm doing a lot of reading and computers and tablets and writing and all. And iba pala yung grado ko for reading. So when I discovered that I needed to correct my distance and my reading at the same time and had it corrected, I no longer felt that eye strain. So see a doctor, and hopefully your doctor can be able to assess your far vision as well as your near vision and correct both para you won't experience these symptoms anymore at makapag-aral ka ng mas mabuti. Look at my eye. My eye is straight when I'm looking straight at you sa camera. Look at my eye when I'm looking here at my finger, something that's near to me. Diba they converge? So, ngayon, your eyes need to converge or diverge depending on the distance that where you're looking at. Okay? Ngayon, what you're saying is you're having double vision when you're looking far away. So, when your eyes are supposedly straight, probably one is turned inwards or one is turned outwards, and that's not a good sign. So you better see a doctor to assess your alignment, eye alignment. So we'll be if you'll be seeing me, I'll be needing to use some prisms. I'll be using some tests, stereopsis tests and red-green tests. There's so many tests that I need to do to assess if there is a possibility of strabismus. And strabismus can be caused by a lot of things. It can be purely visual. But sometimes, if it's, sudden, yung eye misalignment, it can also be due to a neurological cause. So, yung tear duct natin, you see, our eyes, there's glands there, and these glands secrete tears, okay? And these tears flow out through this duct. There's a hole here, and this duct passes through a canal, flows towards our nostrils and out to our nose. Kaya minsan pag sobrang iyak mo, daming lumabas na tears, nagiging sipunin ka rin because it goes through these nostrils. Ngayon, yung complaint mo na very itchy yung tear duct, there might be some bacterial infection going on in there, so you have it checked para it can be managed kaagad and it will not get worse. I'm not really sure how your doctor conducted your assessment, so I would not discuss yet if hindi ka pa talaga pwedeng mag-prism or what, or yung other alternatives. But, if you're really looking for, kasi when you have esotropia, there's so many ways to correct it, okay? So many ways and so many combinations of these ways to correct it depending on your specific problem. So, one of the ways is prism, one of the ways is vision therapy, and one of the ways is strabismus surgery, okay? So, we don't really have to choose just one. We can use a combination of the three, okay? And it's best to try to get a second opinion regarding this and to get a more honest to goodness perspective on the three kinds of management for esotropia. And then afterwards, once you've gotten this second opinion and once you've heard the opinions about strabismus surgery, about vision therapy, and about prisms, then proceed with caution. Yeah, I just wanna know kung yung bagay ba na tinititigan niya nasa malayo ba or nasa malapit, because there's a big difference, no, sa it's a big factor kung saan siya nagkakaroon ng eye misalignment. I hope I can give you the best treatment, but there's so many factors that I need to consider. There's a long assessment that we need to conduct before we can discuss with you any treatment option. But as I've said in the previous question, when it comes to eye misalignments, there's three types of managements that we can do. We can use vision therapy, we can use eyeglasses with prism, we can also use strabismus surgery, or we can use a combination of the three. So get an assessment, and get it from a doctor who can discuss with you all these three things, okay? Not just one management, two managements, or three. Get a doctor who can discuss with you all these three managements so that you are aware and well-versed about the pros and cons of each therapy procedure. Yes, it can. So, yung cornea natin, yung pinaka-frontmost covering ng mata natin, doesn't have any blood supply, okay? Wala siyang blood vessels. That's why it's very transparent. So where does it get its nourishment? It gets it from the oxygen from the air and from the tears, no, that are secreted by the glands that surround the cornea, the eyelids, no? If the secretion of these glands is not enough to lubricate or to provide nourishment to your cornea may suffer, okay? So, pwedeng magkaroon ng problems yung tear layer mo, yung tear film, the frontmost anterior layer of tears that surround your cornea. And if there's a problem in your tear layer or anything in your transparent media, which involves your tear film, your cornea, your lens, and your vitreous, it can have a drastic effect on your vision. So the difference for me of an ophthalmologist and an optometrist is an ophthalmologist is more focused on medical and surgical interventions, while an optometrist is more focused on non-surgical and non-invasive interventions. So ano yung mga specialties na meron sa optometry practice? So we have specialties in pediatric optometry. We have specialties in low vision rehabilitation, where we help patients with vision impairments live better lives or gain more independence by providing them with low vision rehabilitation na mga optical aids like very special glasses para ma-lessen yung kanilang visual disability. Meron din tayong specialty. Optometrists have specialty in RGP and specialty contact lenses or scleral lenses, mga hybrid lenses. So these are for patients who have very high refractive error, sobrang tataas ng grado, or deformed corneas such as in patients with keratoconus, or na-injure yung cornea, or corneal transplant, no? They would need this kind of specialty lenses so they can see better, they can see clearly. Sa prosthesis, kunwari may natanggalan ng eyeball or merong nagkaroon ng deformity sa isang mata, we can make it more aesthetic, no? Para the patient will have more confidence, will be able to go out and work or go to school with confidence, no? So, prosthesis. And then, we also have a specialty called myopia control. Right now, it's one of the most threatening refractive errors there is, and it's very common. Yung myopia or nearsightedness, malabo yung paningin sa malayo. I'm not really sure why you're experiencing that, no? Yung nakakalula or naduduling ka kapag ka suot. If these are like standard glasses, like, you know, parang its main purpose is to help you see clearly at far, then you're not supposed to feel that. But if these glasses has some form of progressive, yung may grado siya sa malayo at sa malapit, and it's your first time to wear it, then there may be a need for you to adapt to it. Just make sure that your doctor is informed about it, and you also have to make sure that your doctor is able to answer your questions and your concerns regarding yung pag-adjust mo. If sobrang hindi ka comfortable or something, you make your doctor aware para alam niya at ma-manage ka niya ng maayos yung adaptation mo. The cases of my patients, it's very important na they're comfortable with their glasses. Before ko yan ipapagawa yung glasses na yan, I have to make sure that they're comfortable with their glasses. In case that the grade is just high and it's their first time to wear glasses, and you know, they tell me that, you know, I really need this grade because I really need to see clearly even if medyo naninibago ako, then I still prescribe it. Or minsan naman pagka minsan may mga ganun talaga adjustment periods, pero siguro pinaka-matagal na yung 1 month sa akin na hindi komportable. Dapat 1 week comfortable na as much as possible. And I don't know with other doctors, but in my case, kapag ka ang patient ko 1 month na niyang ginagamit, di pa rin siya maka-adjust, di pa rin siya komportable, I am very much willing to replace that glasses free of charge. A lot of optometrists are really well-versed when it comes to dry eye management. So sa dry eye management, there's a plethora, there's a lot of ways to manage it. Okay? So let's start with the most common, most traditional, yung eye drops. Eye drops can come in different sizes and forms. So minsan it comes in a bottle, sometimes it comes in a vial. Okay? So my rule of thumb is if you're using a bottle, you should discard it after 1 month from the time you opened it. Kahit may natira pa dyan, you throw it away, okay? The bottle is only good for a month, okay? Yung tira nun, hindi na, for me, it's no longer sterile, okay? So, do not use the bottle longer than a month. You can also use yung vials. Yung vials, they last for 24 hours. And then, there's this brand na you can just put back the cover. So, pwede mo siyang magamit within 24 hours. You don't need to open it and throw it away kaagad. Okay? So, meron ganon, the vial forms. And then, there's also different active ingredients. So, personally, sa akin, my personal favorites are the hyaluronate and the carboxymethyl cellulose. But, let me check ha, yung ibang mga active ingredients natin. Yeah, we have polyethylene glycol, polyvinyl alcohol, propylene glycol, glycerin, and mineral oil. So, yun yung mga common active ingredients. Ngayon naman, doon naman tayo sa ibang management. Okay? One management is a punctal plug. We have here yung, we have a hole right here. Okay? We call it the punctum. Punctum, that's where nagde-drain yung tears natin, yung outflow ng tears from the surface of our eye down towards our nose. Okay? So, yan yung punctal area. We can put a plug right there. Usually, what I recommend is a collagen plug. So, we put it there para yung tears na napoproduce ng mata mo stays on your eye for longer periods. Okay? So, kahit na konti yung tears mo, since mabagal naman yung outflow, it can stay there. So, your own tears are lubricating your eye instead of using eye drops. So, we can use a punctal plug. And then, pwede rin tayong gumamit ng tinatawag natin na phototherm. So, this is the most recent advancement in dry eye treatment. It's the most advanced eye treatment, and we have it here. I'm probably the first one to have it in Mindanao, and probably the first optometrist to have one in her clinic. So, phototherm, we use IPL, intense pulse light therapy, okay? And meron siyang strong light at meron din siyang konting heat. So, lahat ng oils that are stuck in your meibomian glands, they are melted so that mas mabilis siyang ilabas. Okay, that's one. Next is yung mga inflamed na mga blood vessels and dilated na blood vessels, napapashrink niya. Okay, at natatanggal niya yung inflammation. And then, did you know na merong mga mites? We call this Demodex mites. They look like kuto. And they live in your eyelashes. But they're so microscopic, you would never know they are there, but they are there. And sometimes, if there's a lot of it, especially in patients who have severe dry eyes or seborrheic blepharitis, IPL or phototherm can kill those mites. So, you see, there's a lot of treatments for dry eyes. You don't need to suffer. Visit a doctor and, try to ask your doctor what treatments he or she can offer. And if you've tried all these treatments and it still hasn't worked for you, yung eye drops and all, try IPL or phototherm. You're gonna love it.
The next one naman po is from Midwife Edgar. Doc, medyo urgent po ito.
Okay, urgent. Sige.
Doc, normal pa ba? Bigla-bigla na lang akong naluluha kapag naaalala ko siya.
Ay! Wait! Urgent! Ano yun? Biglang naluluha pag... Siguro sinong naalala niya? Siguro sobrang love niya. Tapos, siguro iniwan siya. Anong treatment dyan? Di ko alam. Siguro ang treatment dyan ay mag-move on. Oo, yan. Yan yung treatment natin, mag-move on. I'm not sure about adults, but whenever I speak with parents and advise their kids to lessen their gadgets time, or they're the ones telling me na, Doc, you tell my son, pagalitan mo yung anak ko. Kasi ang tagal-tagal ko na sinasabi, tigilan niya yung pagsa-cellphone niya, di niya tinitigilan. Okay, you know what I tell the parents? Ma'am, your son is using the phone because he's bored, because he has nothing to do. So you cannot let him stop using the phone unless you give him something else to do. Okay? So instead of saying, stop using the phone, anak, you just tell him, anak, can you read this? Or can you do this? Or anak, let's go outside, let's go biking, let's go play basketball, let's go running, let's go to the gym, or a whole lot of other things. Anak, you help me in the kitchen. You help me with slicing these vegetables kung medyo elementary at malaki na. There's so much, paggawin nyo ng gawaing bahay at lahat. You give them something to do, okay? You just don't tell them to stop using the gadgets or you stop using their phone or tablet. You give them something to do para they won't think of picking up that phone, okay, or that tablet. When it comes naman sa adults, it's really hard right now. Kahit ako, hindi ko mapigilan. I'm really, really doing my best not to use my social media anymore. But so hard because my work is there, my life is there, my communication with everyone is there. So, it's really part of our lives na as adults, no? Yung phones and gadgets. So, parang I would be a hypocrite if I'm telling you that I'm not using the phone as much as you do or as much as my patients do, because I am. The only thing that we can do right now is to protect our eyes from blue light that is emitted by these phones, okay? So, ang problem kasi natin, ang pinaka-problem natin, if we're so exposed to blue light that is emitted by these tablets and phones, we have a hard time sleeping at night. It destroys our circadian rhythm. So, it's very important to wear glasses that have blue light protection, okay? And then, as much as possible, 1 hour before you go to sleep, you stop using your phone na. Para, yun na yung it sends a cue, it sends a signal to your brain that it's time for your eyes to rest and there's no more blue light exposure or anything, you are able to sleep better. And if you can, for good measure, if possible for you, did you know that red light, okay, minsan you can change the bulbs, but that's so weird to do. But experiments and studies show that if you use red light on your bedroom, it makes you more relaxed. And it helps your body and your brain sleep faster. Okay? So, yun lang yung natin. I think that's the pinaka-danger lang ng phone. It destroys our circadian rhythm, our sleeping patterns. And of course, it breeds nearsightedness. Kasi you don't go out anymore, no? You just stay home and you just use your phone na lang palagi. So, nagiging nearsighted ka, tumitingin ka lang sa malapit. So, nagiging blurry na yung paningin mo sa malayo kasi hindi na nakaka-adjust yung paningin mo, yung mata mo sa malayo, hindi na niya nakikita yung malayo. So, hindi na nasi-stimulate yung muscles that are involved for looking at far. Habang yung muscles that are involved for looking at near are so well used, no? Kaya, parang nagiging nearsighted. So, yun yung pinaka-avoid lang talaga natin. And lastly, every 20 minutes of near work, stop for 20 seconds, look 20 feet away. So, kunwari, nagbabasa-basa ka, ayan. Tapos, after 20 minutes, tigil ka, tingin ka sa malayo, count ka 1, 2, 3, hanggang 20. And then, you go back. Para, you are giving your eyes some time to relax. Actually, there used to be no treatment for color blindness. Pero, there's a lot of factors kasi bakit nagiging colorblind din yung isang tao. It can be genetic, okay? So, common siya sa males than females, but it's genetic. Pero there are also times na it's caused by medications, no? Lalo na yung mga nagtitake ng mga anti-TB na medications or very strong antibiotics. They can sometimes have effects on our color vision. So, yung mga ganon, we are lead poisoning, other kinds of poisoning, chemical poisoning. This can also cause color vision problem. So, if it's caused by these problems, pwede siyang ma-reverse. Pero sa genetic problems, sa traditionally, we cannot correct it. But there's a current study, okay? There's an ongoing study where we use special lights, we call it syntonic phototherapy, to stimulate the retina and to help it recognize colors, okay? I'm gonna try to invite the proponent of that study next time, okay? So you watch out for that video because I'm gonna invite the proponent of that study here. Ano yan? That's blepharospasm or myokymia, yung pumipitik-pitik. Ibig sabihin, sobrang pagod ka na, no? So, sometimes our body has different cues and signals to tell us that, hey, it's time for you to rest. And sometimes, matigas yung ulo natin, we just want to finish the job, regardless of how our body feels. So, you get these blepharospasms, myokymia. It's harmless, okay? But it tells you to rest talaga. Don't underestimate these cues to rest because it can harm your body in the long run. Yes, bakit naman hindi? Okay? Pero yun nga lang, there's some criteria that we need to pass. Okay? Number one is age. We can't do LASIK on really young patients. Okay? Some do it as young as 18 years old, but there are some doctors na gusto nila 21 years old. Meron ding ibang doctors that are very conservative. They wanna do LASIK pagka the patient is 25 years old and up. So it depends on your doctor kung gaano siya ka-aggressive or ka-conservative with regards to age. Next natin na tinitingnan is yung corneal thickness. So, LASIK surgery will be done on the cornea. So, we want the cornea to be thick enough to undergo that surgery because if the cornea is not thick enough to go through LASIK surgery, it can cause complications like keratomalacia or softening of the cornea, and once you experience keratomalacia, your vision will deteriorate and your cornea will also deteriorate. So that's something that we don't want to do. Another very common side effect, no, post LASIK is yung tinatawag nating severe dry eyes. Okay, nagkakaroon ng severe dryness. So, you just make sure lang that you are aware of the side effects of LASIK before you undergo LASIK, and you are also aware of the criteria of your doctor with regards to LASIK surgery and if you pass that criteria before proceeding. Yes, of course. We can do orthokeratology for you. So sa orthokeratology, we'll be using a special mold that you will wear, that you will put on your eye while you're sleeping, and when you wake up, you just remove that mold and voila! Your vision is clear without glasses and without surgery or contact lenses. Normal lang, clear na. I don't think mabubulag ka talaga because of lazy eye. Usually kasi lazy eye happens when there's usually one eye lang ang lazy eye. So you have another eye that's still functioning. Okay? So you can still do a lot of things. Yun nga lang, hindi kasing accurate ang vision mo. So paano ba yung accurate vision? When you are driving a car, okay? At magpa-park ka, or tatansyahin mo yung distance mo from the other cars, medyo semplang ka doon. Hindi siya So I don't really advise patients who have uncorrected lazy eyes to drive because they are a hazard to others on the road and a hazard to themselves. But other things like reading, looking far away, titingin ng TV, kaya mo namang gawin. Okay? Pero meron din tayong very, very rare forms of lazy eye where both eyes cannot really see well, okay? Even if they are corrected with the best management. So kapag ka ganyan, magkakaroon ka talaga ng difficulty sa mga everyday na mga activities mo. So regardless if your lazy eye is binocular, dalawang mata, or your lazy eye is monocular, isang mata, it is always best to manage it. Okay? Because we want clear and accurate vision so that you can your activities are not limited, and it's much safer for you to have both eyes working together as a team and both eyes functioning properly. So, ano yung managements natin for lazy eye? Number 1 is we have to correct the vision of that lazy eye. Number 2, we have to conduct vision therapy so that we can improve or rehabilitate yung vision and yung communication ng eye and ng brain para mag-function siya efficiently. Okay, here's how scleral lenses work. Okay, so if say for example you have a very high astigmatism because probably there's a problem in your cornea, okay, but not all the time. There are a lot of reasons for astigmatism. That's just the common cause. There's a problem in your cornea. So example, there's a problem in your cornea, that's why you have astigmatism. We're gonna put a scleral lens right there. And the scleral lens will artificially make the surface of your eye regular in shape, no? Iko-compensate niya yung irregularity ng cornea mo para when light will enter your eye, it will enter it in through a smooth and regular surface, and the light will not be scattered, so it will be focused directly on the retina and not focus on different directions, just as when you have astigmatism. So that's what the scleral lens does. It helps you see clearly. It does that with the use of a scleral lens. That's something that eyeglasses cannot do. Okay? Eyeglasses cannot artificially correct the surface of your cornea, but scleral lenses can, and can do it very effectively and very comfortably. It depends on where you got your lenses, okay? Regardless of what lens you're using, whether it's anti-radiation, UV protection, blue light, or whatever, these lenses, we call these ophthalmic lenses. These are medical grade lenses produced by laboratories na parang that passed ANSI standards, the American National Standards Institute standards. So we have very high standards when it comes to lenses, okay? The lens that you're using in your camera, lalo na yung sa mga phones or sa mga magagandang cameras, that's the same quality that we need for your glasses. And minsan, nauuso ngayon bumibili ng UV, ng anti-radiation, blue light lenses, ganyan-ganyan, sa online, or they buy it sa Tiangge or sa stores, or just any department store. They don't really get it from a doctor who buys or who gets it from a legitimate laboratory. Well, these lenses do not pass the ANSI standards and may have aberrations. Okay, so what are these aberrations? These aberrations, kunwari, di ba, as I mentioned, dapat sobrang ganda nung transparent media mo, yung lens mo, or whatever transparent surface, para pagpasok ng ilaw, it will pass through it straight, no? Hindi siya magdi-disperse ng light. Ngayon, yung mga substandard lenses that do not come from legitimate laboratories, pwede siyang mag-disperse ng light in different directions. And these aberrations can cause your refractive error, or pwede siyang mag-cause na magkaroon ka ng grado. And that's what we don't want. So even if wala kang grado, still you need to go to a doctor para you can get a lens that is really, really transparent and that's well made and that's specific to standard. Yung starburst, yung ganun, yun yung sinasabi ko. Yan yung visual phenomena na na-experience mo kapag pagpasok ng ilaw sa cornea mo or yung pinaka-frontmost transparent covering ng mata is kalat. Kaya pag nakikita mo yung mga lights, instead na nakita mo siya na isang point, no? Isang point source, you see it as a starburst. Okay? So, that's how astigmatism works. Okay? That's how it occurs in your eye. Ngayon, if you're using eyeglasses, baka yung eyeglasses mo is not fitted to your astigmatism, or maybe your astigmatism is just too high, too severe for your glasses to correct. And you might need specialty contact lenses that would be customized and specific to your severe astigmatism. actually a lot, not a lot, there are contact lenses that you can wear while sleeping. One is orthokeratology, and that's the hard lens. And meron din tayong soft lenses that you can wear at night. Saan ka makakahanap nito? It would be best prescribed by an optometrist who specializes or who focuses on specialty contact lenses. Yes, it's very safe. A lot safer than LASIK even. Okay? So, what I love about ortho-k is it's non-surgical and it has very zero to minimal risk. It's ultra safe and we use it for very young children. It depends on the doctor's expertise and the doctor's level of experience and how aggressive or conservative the doctor is. But in my case, the youngest patient that I have handled na pina-ortho-k ko at nakapag-ortho-k safely naman is 3 years old. And that's how safe it is. Yeah, I'm also malungkot for you. But there's a lot of uncertain things that can happen, okay, during LASIK surgery. Okay, how do I comment about this? I don't wanna ruffle some feathers, so I'll just say, just try to follow your doctor's advice. Syempre nakakalungkot, di ba, that you want your vision to be 20/20 and that's why you underwent LASIK surgery, but you know, it did not go the way you wanted. But you know, even if the doctor does his best or her best, there's so many uncertainties pa rin when it comes to surgical procedures, right? So just try to follow your doctor's advice and then hopefully magawan ng paraan sa enhancement. Depende na rin yan sa'yo if you still wanna go sa enhancement or not anymore. So if you don't wanna go sa enhancement anymore, you can try a different way of management like glasses. Meron na rin tayo ngayong tinatawag na post-LASIK ortho-k. So it's new. We're developing it. We do ortho-k sa mga patients na nakapag-LASIK na. Either recent lang yung LASIK nila or matagal na, 10 years ago na yung LASIK nila and bumalik yung grado nila after how many years of LASIK. So, it depends talaga. There's so many ways naman that we can manage it. Pwedeng yung suggestion ng doctor mo na enhancement, pwede rin tayong bumalik sa glasses, pwede rin tayong mag-post-LASIK ortho-k. I hope you find this vlog informative and helpful. Remember, your eyes and your vision are important, and I am here to help you take care of it. See you in my next vlog. Bye!